Hey guys, we are Group 5, and our topic was professional member organizations in the healthcare industry. And there's Chelsea Hitchcock, Tanner Peterson, and Jackie Clay. And Jackie Clay is talking right now to go into the first part of our presentation. We found this quote that kind of explains why you might want to join a professional organization that kind of helps explain things. And it says, membership in a professional organization can do so much more than look good on a resume. These associations offer educational opportunities, conferences, research, connecting with other professionals, and job search opportunities. That kind of explains why people might look into paying money every year to be part of these organizations. So the order that we're going to go in is we're going to first list the most significant professional organizations for the different divisions for healthcare administrators, healthcare financial managers, physicians, ambulatory surgery center administrators, medical group practice administrators. And then as we go through those, we're going to talk about the benefits provided to the members that are part of those organizations. And then we're going to end with an explanation of trade associates like Healthcare Supply Chain Association. So our first professional organizations are for healthcare administrators, and we have the American Association of Healthcare Administrative Management, and it's abbreviated AAHAM. Our member dues for that is $210 annually. And then the next one is American College of Healthcare Executives, abbreviated ACHE. And they have annual dues are $150 per year for the first 2 years, and then $250 in years 3 through 5, and $325 after 5 years. American Health Information Management Association, abbreviated AHIMA, and they pay $175 annually. And then Healthcare Administration Association, HCAA, is $500 annually. And then the National Association of Healthcare Access Management, NAHAM, pay $97.50 annually. So the benefits that they provide, AAHAM is the leading professional organization for administrators, and their mission is to provide education, certification, networking, and advocacy for healthcare revenue cycle professionals. And then ACHE is their members are automatically enrolled in one of the greater than 80 chapters at no additional cost that offer local education programs, career and advancement tools, as well as opportunities to volunteer and connect with healthcare leaders in the local community. And Brother Taylor posted in our announcements, I thought this was pretty cool, that there's actually an LDS caucus of ACHE members who convene annually in Chicago during the ACH convention. So there's basically like a group of LDS people that play a big role in this group. So I thought that was a little neat piece of information. Next is AHIMA, and their primary goal is to provide the knowledge, resources, and tools to advance health information, professional practice, and standards for the delivery of quality healthcare. And then HCAA is their members benefit from the third-party administrators and the professionals who serve them. So one of the most useful resources for healthcare administrators is this organization, and it just helps them stay on the cutting edge of industry and business issues, and will also benefit from open exchange of information. And then NAHAM works to promote best practices, standards, and subject matter expertise, provide a variety of networking, education, and certification opportunities. And then our next section of professional organizations is for the healthcare financial managers. And their big organization is the Healthcare Financial Management Association, abbreviated FHMA. And they pay $198 to $298 depending what access you want to their various conferences, seminars, certification, etc. So you can kind of select how much you want out of their organization. Some benefits they provide: members have access to many different tools to help further their careers. So those conferences and seminars, things like that, they can access to learn more and just kind of keep up on their current education.
I'm Chelsea Hitchcock, and I'm going to cover physicians, ambulatory surgery center administrators, and medical group practice administrators. So for the physicians, I found the American Association for Physician Leadership, American Academy of Family Physicians, American College of Physicians, and American Medical Association. And just a note there at the bottom is that there are additional professional organizations for physicians with a medical specialty. So for pediatrics and all that, there's so many organizations for them as well. Okay, so for the first one, the American Association for Physician Leadership, they have this quote on their website that says that the American Association for Physician Leadership is the only professional association solely focused on developing and supporting physician leadership through lifelong education, professional development, community, and influence. Their membership dues are, for the general physician, is $295. For residents, it's $50, and for students, it's $60. And they have a bunch of benefits for those who join. They get a discount of 15% from education courses, so for their continuing education classes. They get a free subscription to the Physician Leadership Journal and access to the Physician Leadership Library. They have webinars, discounts on medical books, access to physician-focused career links, so they can get on there and work through their, if they want to advance their career in whatever, they have access to that. And then they also have access to, there at the bottom, the mentoring program, which is probably a big part of being a leadership, is having somebody to mentor you. So the next one we have is the American Academy of Family Physicians. And they members expect the Academy to act as their bold champion in areas of strategic importance to them, including advocacy, practice enhancement, education, and health of the public. So they're not just a professional organization, they're an advocacy group as well. Their membership dues for an active member is $430, and they have continuing education reporting tools. They help them through that process of continuing their education. They practice enhancement resources for the CME. They have discounts for it. So their main focus is helping those physicians stay on top of things, on top of current medical practices. The AASP staff is there to answer any questions they have for any aspect of their business. And they also have representation at the local, state, and national level, and much more. So the next one we have is the American College of Physicians, and they are an international organization of internal medicine, and they do a little more on the specialist side of things. For physicians, the membership cost for physicians, 8 years or less after medical school is $260. 9 years or more is $535. Residents and fellows in training, $119, and medical students are free. I really like that they open that up for medical students and help them for free to get their career started. So some of their benefits are they get this subscription to their peer-reviewed journal, so they have all these opportunities to look up and see what new medicines out there. They have access to free evidence-based clinical guidelines, policies, and recommendations. Once again, discounts on the CME, and they have all sorts of help for that. And they have free access to the most current evidence-based clinical decision support tools, and that's the Dynamed Plus. And they have a state and national advocacy So once again, they're a professional and advocacy group, and they practice management resource tools. So the biggest one for the physicians is this American Medical Association, and they promote the art and science of medicine and the betterment of public health. And so they're also a professional and advocacy one, and so they do everything they can to help physicians succeed, whether it's in the office or whether it's helping them to be politically stable, I guess, in the medical field. So AMA membership dues, they have all sorts of them, but we'll focus on the physicians. Annual regular membership is $420. For those who are in their first year, it's only $210. Second year, it's $315. Let's go ahead and go on to the benefits. So their benefit is full access to the JAMA network, and the JAMA network is a variety of innovative tools that provide insight that matter most to medical research and practice, and they also get a subscription to the Journal of the American Medical Association, which is also a peer-reviewed journal that the AMA sponsors. They have expert support through the CPT network. It's a knowledge base so that they can go, it's called a knowledge base, and they go up and they can look up their common questions for just about anything. Access to volunteer and paid medical opportunities, AMA Model Physician Employment Agreement, which is a detailed hospital and group model employment agreement. So it walks you through how to work with the hospitals and with other groups to help them further their careers. AMA physician profiles, so that's where they can get on there and they can do their licensing and application and stuff for their license on there. New payment model resources. These AMA resources help them evaluate their options and negotiate new payment and delivery model. The Change the Shape AMA policy, so that gives them the opportunity to participate in making AMA better. So it's not just the head of the organizations in charge. The physicians get to participate in that and help change AMA to better help all of the physicians. And then they also get a discount on financial insurance products and financial services. And they have a nationwide network of colleagues. All of these organizations, I think the biggest thing is that they have this opportunity to talk to other people just like them and get real life advice on things. And then there's some other benefits there. Let's go ahead and go on to the ambulatory surgery center administrators. I was able to find this one. It's the ASCA, and it's the Ambulatory Surgery Center Association. So the ASCA is the only membership organization dedicated to providing all ambulatory surgery centers with the resources and support they need to continue to deliver the high-quality care and patient-focused surgical services. And as I was looking on there, they have a lot of local chapters, but there isn't really any other that I could find associations that professional organizations for the ASC. So, and I couldn't find how much their membership dues were. But some of the benefits of being part of this organization is that they're part of the government advocacy team that promote ASCs before legislators. They have the opportunity to benchmark to improve their services. They have digital and print educational resources on the best practices, regulatory compliances, and industry trends. And they also get this membership to the ASCA Connect, which is where they can go online, and there's a forum where they can talk to other ASC professionals, and so then they can, once again, network and talk to them and see what works and what doesn't work. And then they also get discounts for going to the events for ASCA, and they also get a free subscription to ASC's Focus magazine. And once again, they're at the bottom, one-of-a-kind networking opportunities with nationwide networks of ASC experts. Okay, so for the medical group practice administrator, I was able to find only one there as well. It's the Medical Group Management Association, and it has local chapters in several states as well. So MGMA is a great resource to anyone new to medical practice management because it assimilates all of the tools you will need to be successful in one place. For the more experienced management professional, it opens up a network of professional peers to whom you can turn when you have a specific problem or just need advice. And this was Alan Winkler. He's one of the executive directors out of Texas. Okay, so the membership dues for an individual is $399 for 1 year and $699 for 2 years. And then they have I don't know how much a board certification application costs, but they have this membership that includes that for $599. A professor at a college can have one for $155, and then students get them for $35, with uniform services paying $285 a year. So some of the benefits with the MGMA is access to award-winning professional publications, member-exclusive web contact and benchmarking tools, the latest in what's going on with the legislatures, access to professional certification or fellowship, dynamic networking, research and support opportunities, and professional development and educational resources, and once again, that networking that allows them to talk to other people and see what works and what doesn't.
Okay, that brings that to me. My name is Tanner Pedersen, and I'm going to be sharing about trade associations and what those basically are. And so a pretty simple definition is that it's an association of people or companies in a particular business or trade organized to promote their common interests. And a very simple kind of explanation is like I scratch your back, you scratch mine kind of exchange. And what came to my mind is basically like when you're building a house, there's all these types of different contractors that have different skills and different assets, but they all kind of come together to help make the main goal achievable. And so how that becomes relevant for the healthcare, to healthcare, are there several different medical practices that wish to share their customers and patients for two main reasons. And the first one is basically to provide the best possible medical assistance for that patient, but also to promote their practice for further business and just meeting their supply and demand. If you wanted to see a better example of that, you could go to one of these links like trade.gov. That one has actual lists of healthcare trade associations. And then it also talked about one example was the HSCA, which takes us to the next slide. So the HSCA, also the Healthcare Supply Chain Association, is basically a broad-based trade association that represents 15 group purchasing organizations, including for-profit and not-for-profit corporations, purchasing groups, associations, multi-hospital systems, and healthcare provider alliances. And I liked how it said for-profit and not-for-profit, how they're meeting the needs for both of those types of businesses so that everyone can get a little bit of it in there. And so that'll take us kind of to the next slide, talking more about the HSCA's mission, which I thought would be interesting to share what their main goal is. And how they talk about it is like the advocacy is that they work collaboratively with all legislative and regulatory authorities to ensure fair and efficient procurement practices in an open and competitive market within the health industry. They focus on education, which provides opportunities designed to improve efficiencies in the purchases, sales, and utilization of all goods and services within the health industry. Their ethics are where they uphold and conduct of business practices within the industry and the standards adopted by the healthcare group purchasing industry initiative that are intended to strengthen the integrity of the healthcare company chain. And their information is they enhance the awareness of their members' efforts to support the delivery of high quality, cost effective healthcare. And then the liaison is they promote meaningful dialogue between healthy industry organizations engaged in group purchasing and other industry entities on issues of mutual interest. The link right below that logo gives us a little more on that specific trade association, but there are a lot of other ones out there. But basically, they're just kind of there to help meet the supply and demand of these healthcare industries to make sure that their business gets out there, but that they're able to provide what they say that they can do. And then that next slide is basically just the rest of our sources, but that is everything that you guys need to know about professional organization from Group 5. Thanks for listening.